Productive Dentist Academy podcast network.
Welcome to the Everyday Practices Dental Podcast. I'm Reagan Robertson, and my co-host, Dr. Chad Johnson, Dr. Maggie Augustyn, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take into your own dental practice. If you are ready to reclaim your time so you can focus on great patient care without sacrificing yourself along the way, buckle up and listen in.
Come to find out, we gave it to him last time at no cost. So I said, Jerry, let me get this straight. Are you upset that I've been more generous with you in the past, that I gave it to you for free than now? I mean, like, is that what you're upset about? Is that I've been too generous with you in the past? And he didn't have much to say. He kind of I think he took my energy and was like, oh shoot, this guy's,
He's legit.
Oh, and he's upset because I think, the goal was I'm going to be the upset patient. Then I come in and I'm like, well, I'm the upset business owner and you've taken advantage of me too long. Everybody, this is Everyday Practices Dental Podcast, and I'm sitting talking with my co-host, Dr. Maggie Augustyn here. Dr. Maggie, how you doing?
I am doing great. And we have been in the middle of a conversation.
A heated
conversation. And then we thought, you know what, why not let our listeners in on this, because this is a struggle that we are constantly having with our patients. And in this particular podcast episode, we are going to cover how patients complain about paying or not paying for a service.
We're going to complain about complainers. It's awesome.
Listen, we've got our own,
right.
People that we are here to help, and we all learn from each other's experiences. And so Chad here is a little hot and heavy, so I'm going to let him calm down for just a second, because I'm going to start us off with a conversation about a patient. Now, I am completely forthcoming and always have been. I practice as an in-network PPO dentist, and so there's a way to make that work 100%, and we're definitely doing that. But I want to start us off with a story about a patient that I saw who came in for a consultation on an implant. And someone had told her that this implant wasn't working, and then she came in for our hygiene visit, and these probing depths are getting higher and higher and higher. And she just does not know why. And so, something very special happens after you've been doing dentistry for 25 years. It's like, I don't know if you say that you enter the matrix or you exit the matrix, whatever it is, but there's a lot of things that kind of start to overlay. And so I look at the radiograph of this implant, and, the abutment that was used is larger than the implant. Right. And so, why do you think you're having problems? Right. This is mismatched. And look, I'm not here to call out another dentist.
Yeah.
Because we have all had our own learning experiences. But she comes in hot and heavy, very hot and heavy. This is a very difficult patient to manage. First thing I did is I put on my white coat, which I almost never do. And the reason why I did that is because this particular patient needed an air of authority. Like, you just kind of pick that up. Right. And then I go in and I say, this is what's happening. You need to have surgery. You need to have this cleaned out. You need to replace the crown, and you need to have the correct pieces used here. Or what's going to happen is you are going to lose this implant, right? You're already on the way there. There's already threads exposed. This is the best that we can do. And so I have this conversation with her, I don't know, at least an hour. Now, again, this is a Delta patient. So imagine how much I'm being paid for this hour, right? I don't know. I'm lucky if I got paid $60, right, for the consultation. And if my hourly is at $1,200, I basically set $1,200 on fire there, right?
Right.
So then the patient comes back in and she leaves a message and says, I do not want to hear her voice, her being me. I do not want to hear back from her. What I need you to do is I need you to call the insurance company and reverse the claim, because she didn't touch me. She didn't do anything. She didn't fix anything, right? Which, of course, is all completely untrue. And so what I ended up saying is, you don't want to talk to me? Fine, I'm not going to make you talk to me. But what I ended up doing and talking to my team about is, I am in network and I have this contract. So I can't pretend that this didn't happen. I can't pretend that I didn't give you advice. And so then I overheard one of my team members talking to the insurance company, basically saying, look, she wants you to reverse the claim because she didn't like what she heard. And so here I am. We would be grateful to lose this patient, in all honesty. She's been difficult from the very beginning. But here's the point of the story. We just have such difficult patients that are so
Entitled.
and they're so needy. And you know what? You need to stand your ground. You need to charge what you're worth. And on patients like that, you need to cut the cord. And if they're saying, hey, refund me this money or I'm never coming back, one, I can't refund you this money because I'm obligated by the insurance to charge you for what we did. Two, I set $1,200 on fire of my own production by sitting there and talking to you. And three, good riddance. Please don't come back.
Right.
And so I think this is a great segue of you, Chad, going into your story and how you set this one particular patient who came in hot and heavy. So tell us that story and let's see how we can break it down and learn from it and give our listeners here some advice on what to do when these hot and heavy conversations come up and we feel like there's no feeling, okay? We are being taken advantage of.
Mm-hmm. So for anonymity's sake, I'll call him Jerry. And I also apologize ahead of time if I back the microphone away and I'm yelling. So your volume control might need to be on your fingertips in the vehicle as you're driving. Okay, Tom in Omaha. Just thought I'd say hi to Tom, Dr. Tom, listening right now. So, goodness. Okay, here I go. So Jerry comes in. I'm seeing patients on a Saturday. We get him scheduled and I come in Saturday morning. He hasn't been in for 10-ish years. He's got a lower overdenture with 2 locator implants that I had placed. The locator broke off. He's been at another dentist for, a few years.
Doctor, are you tired of repeating yourself with your team over and over again, and yet you still see treatment walk out the door? If so, you're not alone. The Clinical Calibration Institute, powered by Productive Dentist Academy, is an all-new online platform that unites your team around your philosophy of care, so patients can say yes with confidence and you grow with purpose. Including online curriculum with world-class faculty, monthly live mastermind sessions for each department within your practice, and an online private community, this is your home to grow. Head over to clinicalcalibration.com today to join every member of your team for one very low monthly membership fee. That's clinicalcalibration.com.
And he has the screw broken off. The other dentist, doesn't know what to do. So I get it out. It probably took me 10 or 15 minutes, which I was super impressed. I told him, I was like, number one, when we do this, we can't be sure that it's going to even work getting the broken off screw head out. And if we do get it out, is it going to be, are the threads going to be stripped on the inside, while we're messing around with the inside? So let's give it a try, but no promises, hate to say it, but like your only other option is to leave the implant there or pull it out anyway. So, no harm, no foul. Let's give it a go.
So I'm going to just small interruption here for our
Yes, by all means.
Because here's the thing, the way to start this conversation is to be completely transparent with the patient and say, this is the issue. This is not my issue. This is your issue, as Bert Baird says, right?
Your
Whose problem is it? This is your problem. But here I am to solve it. And this is what can potentially happen, because having that really honest conversation up front with our patients is going to inadvertently keep us from being in trouble. Because had you not had that part of the conversation and something would have happened, it would have been your fault for breaking the screw. It would have been your fault for this, that, and the other. So communication is key.
Love it.
PDA teaches, right? So step number 1 is be completely transparent and make sure that the patient understands that this is not your problem.
Yep.
You are the hero here and you are trying to help them solve this problem.
That's right. So Saturday morning, He's been billed for limited exam, periapical, and I don't know. I just thought, for it, I don't know. It's neither here nor there whether someone else charges. I didn't charge for the screw removal. Why? Most of the time I'm not going to be successful, and I don't want people mad at me. So there's that. And 10, 15 minutes later, I get the screw out. If you're wondering how, since this is everyday practices, I'll tell you how. I got out of Cavitron and worked in a counterclockwise. And I also broke off a Q-tip and used the flat end of the little wooden topical Q-tip and pushed it down in there and turned. And then I also did a slow speed round burr on the top of it and put it in reverse and use that to, kind of torque on it. So between those three things, I started seeing the screw move up. I got the screw out. That isn't the problem. He gives me.
I'm going to interrupt you one more time because on
All
that
the time.
particular instance, I think it would have been very helpful for you to tell the patient, hey, Jerry, what I just did for you is, one, I charged $1,800 to open an office, which I did not charge you for. And two, I removed this screw and everybody else would have charged you $1,500. And that is my gift to you.
Right. That would have been brilliant. At times I'm brilliant. At this time I was not. So I mean, I was super impressed that I got the screw out. Let's say that, but I wasn't, using my best Augustyn verbal skills. So I got this screw out and, no anesthetic, no pain, no nothing. Out the door you go. I've got the little piece of the broken part. And so I'm going to order the new one. I had it written down at that point. This is dumb. I had it written down which size of abutment that we had used at the time. And this was a different implant system too. But I found it on a website, custom ordered it, overnighted it. It didn't show up for 4 business days. He's on a Thursday now, and he's coming in to get it. It says that it's being shipped. It's getting here soon or whatever, and it doesn't show up. Normally we get our deliveries 10 or 11. So he shows up 10-minute drive from home. It's unfortunate. I go in and I tell him, I'm like, bum deal that we don't have the part yet. And so let's get you rescheduled. And I apologize. We should have, known ahead of time. So my office manager says, why don't we go over cost estimate? And so she goes over the cost estimate, says it's going to be $720. That's going to be $600 for the abutment, $60 for the new locator attachments. And so then he gets all mad. What the F is this and this and that? And he's all mad and stuff. And she comes in and it's like, man, he's swearing at me. He's all mad and stuff. And I was like, Jerry's a gruff guy. So it just is what it is. And, but like, he's not necessarily mad or he's just kind of that way, the angry trucker type or something like that, just like, well, what in the world cost of coffee these days? So I go in the room, cause I hear, man, he's mad and stuff. So I go in the room, Jerry.
I'm going to make another small interruption. When a patient is complaining about cost, okay,
Yes.
I invite them to go to fairhealth.org. And on there it's a website that shows you what is a reasonable cost for this area, right? So if you're charging $680 for this particular abutment, be like, Jerry, go to fairhealth.org. Why don't you look up what I should be charging you? And chances are that I know how you are and your fees are probably way too low. And that's another mind-blowing thing for them. Bro, I just gifted you $3,200 on Saturday. And now instead of charging you $1,200, I'm charging you $680. Okay. I'm getting all riled up too. So just keep.
No. And I came in and I was like, Jerry, what's the deal? What are you upset about? Well, I don't know why I'm, getting charged this. Last time it was, half the cost. And I said, well, we've printed $15 trillion in the last 5 years of money. So I'm not surprised that things cost more. And so I actually don't know why you aren't surprised that things cost more. It just is. I said, you go find me. I'm gonna keep it short and not go on my full rant because I came in unusually hot and bothered by this. And I said, you go find me 3 other cost estimates. Go get 3 other cost estimates. Do it. And you find me a dentist who will do it $30 cheaper. I'll match it because I just don't believe that's the case. This is a steal of a deal. I came in on a Saturday. I took the implant screw out at no cost. He says, no, you charged me. I said, Heather, look that up. I could be wrong. What happened? Limited exam for this much and a periapical for this much. And I said, oh, okay. So my apologies. You weren't charged for the screw removal. So you're correct. I'm correct. But let me be clear. You were not charged for the screw removal. You paid for the exam and the x-ray. You paid for my expertise. There are very few dentists that can do this and have done it successful. And I didn't even charge you for that. So now you're getting charged for the abutment and it's nothing more than what it was before. And he says, well, it wasn't what I was charged before. Office manager, what did we charge him last time? We look it up. Come to find out, we gave it to him last time at no cost. So I said, Jerry, let me get this straight. Are you upset that I've been more generous with you in the past, that I gave it to you for free than now? I mean, like, is that what you're upset about? Is that I've been too generous with you in the past? And he didn't have much to say. He kind of like, I think he took my energy and was like, oh shoot, this guy's,
He's legit.
Oh, and he's upset because I think, like the goal was I'm going to be the upset patient. Then I come in and I'm like, well, I'm the upset business owner and you've taken advantage of me too long. And he came back the following Thursday, which was yesterday, and I gave him a gift card for a local gas station and for not, having the stuff on time for his appointment. And he knew about that.
Was kind of you. That works also. That's another bit of information that our listeners can take.
Yes.
Take from this is like, okay, so sometimes stuff happens. And if it does, just have a bunch of those gift cards. $25,
$20.
Gas station.
25 in Chicago, 20 in Iowa, but 50 in Hawaii, right? So I gave him a legit apology too. I was like, Jerry, there was another one, Matt, sorry. I was like, Jerry, here's the deal. I'm really sorry that we didn't have the stuff on time for your appointment. Here's a gift card as promised last time, because I just don't like working that way. And I'm super glad that abutment went in today, that we got the new part switched out, that it clicked down well. This is really a win-win. And I didn't say this, and yet I'm just like, I hope to never see you again. Like, just move on. But at the same time, I was very transparent and authentic with him. I think overall I was professional. I probably had some borderline moments, but it was very cathartic to share my frustrations with him and not necessarily get bent out of shape. Did I raise my voice? Yes. And I told him though, at the time, I said, Jerry, I'm not mad at you. I'm mad though that I feel taken advantage of, that, that I've got all this expertise to do what very few people can do successfully. And it's not good enough. And that is frustrating. And I hope you can understand that. And turns out my office manager's door was open. I couldn't see anything but red. So, and the whole office heard this conversation and they were proud of me. Maggie, yes. They were proud of me. They were just
had I been there, yes. I would have been clapping, cheering. Yes. I would have, I would have brought you cupcakes.
Yep.
It would have been like with a candle and everything. I mean, you definitely, you stood up for yourself. That's
yes.
right. And it's hard to do.
Yep. And to restore the relationship. Like, I don't really want to say, but like, let's say he came back in and then from now on, he's just chipper as ever and brings us cupcakes. Okay, cool. Like, but I think I needed to stand up for myself and my office and my value and what it's worth. So for what it's worth, listeners, I'm actually, that's, the fourth or fifth iteration into telling the story. So now I'm kind of cooling down about it, but probably in another 5 times of me telling it, I'll laugh about it. But right now it's just like, oh, it made me so hot.
Well, it's frustrating. And,
It was.
raise your hand if you're not driving a car. Doesn't this happen to you
Correct.
all the time?
Yep.
So here we are, and this is what we're doing. We are empowering you
Yes.
to do the hard and right thing,
Yeah.
right? It's not, this isn't easy to do. And it took me 25 years of being in dentistry before I grew, hey, I'm just going to say it, the balls to say what I need to say to patients. Now, it doesn't always work that way because there's plenty of really kind people. And by me being so abrasive at the wrong time, I actually turn them off. And it's a learning experience for me. In fact, I have to make a phone call to apologize to a patient who was really kind. And I treated her with this kind of a tight grasp, and I shouldn't have.
Yeah.
So it's a learning experience. We've got to kind of find the balance between when to be soft and when to stand up for ourselves, right? And it doesn't always work out, and it's just a learning experience in our lives.
Furthermore, Google Almighty tells us that CDT dental code 6056 generally ranges between $400 to $1,000, though some have fallen out.
You are welcome, Jerry. So how much,
Yes.
Jerry, did you really get from me? Like $4,000 worth
Right.
of free treatment. So you know what you should do, Jerry? You should buy me
That's right.
cupcakes and
Send me a thank you card for the awesome service I just did.
but you know what? I think the universe or God or whatever you choose to call the power that looks over you, or if you don't have any power that looks over you, karma, whatever you want to call it, this will come back to you and this will eventually bless you for how helpful you have been to this man.
Yep.
Even if he doesn't realize it.
Yep.
You're earning brownie points somewhere.
Yes, and I do like pointing out, and this is just a personal opinion, not those of Productive Dentist Academy, but karma is rough because if you get what you deserve, then that's always a good thing when you feel like you deserved it, right? Like you earned something. But then sometimes we're cruddy people and we should get what we deserve in the bad way. And I'm just so thankful to God that it's just like that I don't get what I deserve at times. And so that might sound sanctimonious to some people, like I'm just, spewing off stuff. But I'm so thankful for this profession, and being in a grateful mindset is valuable. And just being like, I really don't deserve to be a dentist. I sure tried and stuff, so it's not that it's like, oh, I don't deserve it, but it's like, listen, I'm thankful for it. And I'm thankful to be able to treat the patients. Sometimes they are butts and they are difficult. And though it might be rare, and for some people it might be every day, and then that just gets old. If you need someone to talk through, you can write both of us.
They could do Dr. Maggie at myhappytooth.com.
There you go.
RMAGGIE.
And that's fine.
Yeah.
Or chat at productivedentist.com. If you remember mine better, and then I can send it along to Maggie, or I can.
Or you just
copy
like
it.
attention more than I do.
Oh, no, I certainly do. Listeners, thanks for listening on the drive. Hopefully that was a fun, shorter thing, and thank you for being my counselor as I cathartically I don't know a better word, barfed up my junk over the last week and a half of Jerry.
Listen, I'm just gonna ask you one thing that you learned from this cathartic barf.
Yes.
Give me one thing. What is your takeaway from this conversation?
Finding a way to stand up for yourself, and yet dialing it in to where you're not acting ridiculous or whatever, just that you're also coming to this person, treating them humanely and, with decency enough, even if there's yelling, even if there's consternation between the two of you, to be like, Jerry, I'm not mad at you. I'm mad that I feel this way, and, just laying it out, but also setting up some boundaries. So it was a boundaries test without being a ridiculous caveman.
Yeah, I love that. And for me, this has a lot to do with looking at yourself and balancing the energy, because I struggle with this,
Yep.
of when to go in hot and heavy and when to kind of move back. Because
Right.
this is something that I'm still learning about myself. And then the
Always.
biggest takeaway that I hope everybody takes from this particular podcast, in the words of Bruce Baird, is whose problem is this?
Theirs.
It's their problem, right? You are the one that's helping with the situation. You're not creating the situation. And enough is enough.
Yep.
Patients coming in and blaming us for what's going on in their mouth, that has got to stop. And we're going to do everything that we can to teach you how to not take on that problem. And maybe this is a great segue into inviting back our good friend, Eric Recker, because we carry other people's issues with us.
Right.
Unfairly. We shouldn't be doing that. That's not our problem. That's their problem. And let's
That's right.
find a way to, because that's what creates the burnout. We're not here to save everybody. We're there to help them, because ultimately they're the ones that have created these messes in their mouths.
Yeah.
I'm not saying it's their fault. It's just the situation, but we are not, we're here to help and not to be blamed for what's happened.
Yep. Maggie, great discussion with you. Listeners, thanks for coming on. Until next time, Everyday Practices Dental Podcast.
See you later.
Thank you for listening to another episode of Everyday Practices Podcast. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share, or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.